Hi, this is Psych 111 review for Exam 3. Professor Grodman. We're going to be discussing Chapter 8, some terms related to intelligence, thinking and intelligence rather, more so intelligence, although those terms are interconnected. Intelligence, in a sense of as a measurable construct, goes back to Simon and Binet, Binet, in France, the early 20th century. And they developed the term IQ. And it was actually a formula looking at mental age versus chronological age. Specifically, if your mental age was higher than your chronological age, you were bright. And there was a formula that would then calculate into a number. So, for example, your mental age was 8, your chronological age 4, you had a very high IQ. Conversely, if your mental age was 9, chronological age was 16, you had a low IQ. The contemporary view is that IQ is something that looks at largely probably what is known as cognitive intelligence, school-related intelligence. Although there are, according to Gardner, who's not an IQ test developer, but a theorist regarding intelligences, that there are multiple intelligences. Analytic intelligence, kinesthetic, dealing with movement, certainly emotional intelligence, looking at how things are organized in space visually, spatial intelligence. So these are some of the characteristics of what he refers to as multiple intelligences. There is also, and this ties in with the aforementioned Gardner, the notion of emotional intelligence, sometimes referred to as social intelligence, our ability to understand ourselves and other people. This is really hard to quantify, particularly in one sitting. An IQ test, the way it is done currently, it's an individually administered test. The first half of the 20th century was largely a group test. But the notion of a singular behavior or a sampling of behavior at one sitting that measures your ability to understand yourself and others is essentially impossible. Some of the most important decisions we make are over time. What career, what person, where we live, and all those sorts of things that are not measurable in a singular manner. Now, when we also talk about IQ would fall under the heading of an aptitude test, dealing with what we are capable of learning, our potential for learning. There are achievement tests which look at academic areas such as reading or mathematics or science. IQ is not that, or it's not supposed to be that. In fact, in some ways it does tap into some of those things, and it is not intended to. IQ tests, again, are individually administered. The most commonly employed IQ tests, there are only a few of them that are used commonly. One is called the Wechsler, Wechsler, and actually there are 3 versions of the Wechsler, a preschool version, a school age, and an adult version of the Wechsler. And individually administered. It takes about an hour and a half to take this test. And it is artificially created and to look at verbal, there are areas of it which are verbal, areas which are nonverbal. These areas are sometimes referred to as subtests. So the verbal area subtest might be vocabulary or memory or general knowledge. A nonverbal area, something like putting blocks together so they match a geometric design, putting puzzles together, identifying what's missing from a picture. These are all examples of subtests of the nonverbal part of an IQ test. And although I think they may have added one section, essentially IQ has been for the last probably 50 or so years some averaging of your nonverbal and verbal intelligence scores. This is essentially the brain, the left verbal intelligence, the right nonverbal. And the long and the short of it is, it's an interesting score that you get. You derive a score that is essentially based around 100, 100 being the average, and 68% of people score between 85 and 115, and about 90% score, I think actually it's 95%, between 70 and 130. So most people are scoring in the middle, and this is, again, artificially constructed. And with regard to test construction, when you develop a test, what you hope for is it measures what it claims to. IQ tests are supposedly a measure of your ability to learn. And they're at best moderately doing this. It's moderately accurate, or they have what's known as moderate validity. Validity is really what you're looking for, the accuracy of the test. But they are reliable. That denotes consistency. So the tests tend to be more consistent than they are measuring what they claim to be. And that is not a bad thing to have reliability. More importantly is validity, and again, only moderately valid. Part of the reasons, plural, they're moderately valid and not better is that many environmental factors influence IQ, shape IQ. The family you grow up in, the school you go to, particularly primary and secondary schools, very important and very predictive of IQ. Eventually, number of years of education. So, for example, if you have a graduate degree, a master's degree, on average you are going to have a higher IQ than someone who has a bachelor's or an associate's or a high school degree or less. In fact, with every level of education, IQ goes up, which sounds an awful lot like environment, and likely is. If you have 125 IQ with a master's degree and 100 IQ with a 8th grade education, you probably innately, in terms of inborn intelligence, are probably around the same point, but that the education very much affects IQ, particularly in the verbal area with vocabulary, general knowledge, and things of that sort. So many environmental influences. So the long, sort of the etiology of IQ, the causes of IQ, or the influences, are both nature and nurture. One point I want to throw in, one term, additional term, has to do with why IQ tests are typically given. And they're often given because there's some suspicion of a learning problem or challenge or a learning disability. And learning disabilities are often evident when someone struggles in school but seems to be bright, or at least of average intelligence, and has had some exposure to education. So it's not a result of pure deprivation of learning. And IQ tests are used in the evaluation of a learning disability. Typically, IQ and achievement are compared. So let's say someone has 120 IQ. That's a pretty good IQ in the top, probably around 10% of the population. And they're scoring below average in, reading or spelling or something that is verbal in nature. And maybe their math scores are pretty high, commensurate with that 120 IQ. That certainly speaks to the strong possibility of dyslexia, some problem in reading or decoding. That's sort of a classic example of how IQ and achievement are compared. Also, there's something called, and I wouldn't ask you this technical question, but something called intra-test scatter within the test of an IQ test. If you do really well on some parts and very poorly on others, that is known as scatter, having a lot of ups and downs, peaks and valleys. And that's also more illustrative of a learning disability. Okay, let's move on and talk about the one area in the course that goes beyond the book. You hear my notes rattling, and there's quite a bit of information here. You can look online. You'll see that I've tried to spell it out a bit more than most of the terms. I've added some descriptions. And personality, let's sort of start with that. Personality assumes consistency or relative consistency in behavior over time and across situations. Who do you associate often with psychology? Well, not a psychologist, but actually a neurologist by training, and the pioneer of psychoanalytic thinking and psychoanalysis. That's Freud, Sigmund Freud. And Freud, around the beginning of the 20th century, he was also a personality theorist, he outlined 5 stages of psychosexual development. The oral stage in infancy, the anal stage around age 2, the phallic, P-H-A-L-L-I-C, from 3 to 5, latency 6 to 11, and genital 12 on through adulthood. And at each of these stages, there's sort of a developmental milestone, or there are common characteristics. So the oral stage is focused on the mouth and things dealing with gratification and nursing and survival. The anal stage dealing with toileting and being toilet trained. The phallic stage, 3 to 5 again, dealing with feelings, and Freud said this is all unconscious, we have no memory of these things. But the little boy wanting his mother sexually, this is called the Oedipus complex, and the little girl desiring her father, the Electra complex. This is during the phallic stage. Latency, sexual issues are on the back burner, and around 12, hormones start to influence behavior. And Freud says if you've been fixated, stuck in one of the first two or three, really three stages, but when you think about it, often you think in terms of oral and anal. If you're fixated, that means you got gratified in one of these stages, or undergratified. So maybe because of that, you smoke cigarettes, you're overgratified or undergratified, or you speak too much, you bite your nails, or at the anal stage, you're overly sloppy or neat. By the way, there's no current support for this model. We talk about it because it is foundational, but it's not scientifically supported. But we will continue to go through this Freudian theory, this framework. And Freud articulated, and this one actually may be a bit more supportive based on today's literature. Freud articulated that we have these sort of impulses that we're trying to deal with, sexual and aggressive. And we develop these mechanisms to deal with them, which are largely unconscious, not fully, but largely unconscious. The most primitive defense mechanism, according to Freud, is denial. It didn't happen. The most sophisticated, rationalization. You justify something. And there's a conscious element to this. I'm glad I didn't get that high-paying job. It would have taken me out of town too much. I'm glad I didn't get it. That's rationalization. According to Freud, we have a lot of sexual energy, libido, and we reconnect or channel that into non-sexual endeavors, such as work. This is called sublimation. Or when we have pain, we block it out unconsciously, repression. Or block it out consciously where we can access it possibly, suppression. Or we don't like something about ourselves, we put it onto someone else. They're a liar, they're a thief. This is called projection. Or you have these impulses, maybe aggression, and you do the exact opposite. You become an anti-war activist. This is referred to as reaction formation. Freud was the developer of the first psychotherapy called psychoanalysis. And the goal here, the premise is to bring the unconscious to the conscious level. How do you do this? The analyst through varying techniques. You analyze the patient's reaction to the therapist. Oftentimes, Freud found that people loved or hated him. He said they loved or hated him not because they knew him, because they were transferring their feelings toward their parents onto him. And so you analyze that to try to understand those dynamics. This is referred to as analysis of transference. Or people, often in analytic treatment, patients will start to miss appointments or bounce checks. They're resisting the treatment. You analyze that. This is analysis of resistance. Or interpret dreams, dream interpretation. Or ask a person to say a word, the first word that comes to mind, before they filter it out. It's a pathway to the unconscious. This is called free association. The Freudian model, though, is certainly not the only model in town. And in the 1930s, Erikson developed Erik Erikson, 8 stages of not psychosexual development, but rather psychosocial development. These are stage theories, the psychosexual, psychosocial, and one more that follows. Most theories are not stage specific. The view today is that people don't move exactly along the same pathway at the same time. But nonetheless, again, these are foundational. Erik Erikson developed 8 stages, and with each stage, there was a psychosocial crisis, something that shapes your personality. And it doesn't mean it's cast in stone, that's it, you're done. It may be that you don't resolve something early and you come back later on and deal with it. So, for example, in infancy, the first crisis is, are you going to trust or not trust? Trust versus mistrust. And it may not be developed because you may not be parented well, but maybe at age 20 you have a relationship and you start to trust someone else. It can happen that way, but it's, you prefer to resolve the crisis at the very beginning. That would be probably more advantageous psychologically. At around age 2, the crisis, are you going to be autonomous? And if you're not, you're going to feel shame and doubt. 3 to 5, you'll take the initiative. That's a successful resolution of the crisis. If you don't, you'll feel guilty. Tying into school age, around 6 to 11 or 12, industry, a sense of competence versus inferiority. If you're a good student, you'll feel industrious. If you don't, if you have problems with your peers, you're probably going to feel inferior. Many kids do well at home and they start school and they really struggle and they feel inferior. Their self-esteem struggles. This would be suffers, and this is an example of that. In adolescence, it was Erikson's view that you were developing a sense of who you are, identity, And if you don't achieve that, you're going to have confusion, role confusion. This is sort of dated because the notion of sort of who you are and what you're going to be is not usually associated with 13 years of age or 15 or 17, but probably more young adults of today. But anyway, let's go with his theory, at least for now. In your 20s and 30s, he thought the psychosocial crisis was intimacy, establishing a relationship, usually romantic, but can be a friendship, or if you don't do this, being isolated. The 40 to 65 or middle age dynamic where crisis is, are you going to give back to the next generation? If you do, as a work supervisor, as a parent, as a coach, as a mentor, as as a public advocate, or whatever it may be, to help other people, particularly younger people, this give back to the next generation is enriching, and it's facilitating personality development and growth as a human being. If you don't do this, you're probably going to stagnate. Finally, it was Erickson's view that around 65, you're going to take stock of your life. And if you've had a good life, you'll say, okay, it's been good. It's had meaning and purpose. This is ego integrity. If you don't have this, you're going to be very angry and upset. This is despair. Now, this is a model when the lifespan was about 62 years. Now it's almost 20 years longer. So one might, if they want to sort of put it in 2020 terms, look at this as something that happens in your 80s or even 90s. But it has relevance. Finally, the last stage theory is associated with Lawrence Kohlberg. Kohlberg talked about levels of moral reasoning. That normally we have sort of a growth in our moral reasoning to a point. Most people don't fully achieve the highest level. It's sort of like self-actualization. Most people don't become self-actualized. He said at the most basic level, or pre-conventional moral reasoning, the 2, 3, 4, 5-year-olds' behavior is based on consequences. Can I get that cookie out of the cookie jar without being yelled at? Most people, according to Kohlberg, move to the next level. This is called conventional moral reasoning. And your decisions are not based on necessarily just consequences, but rather adhering to social mores, laws, and rules. And starting in childhood and continuing throughout your life, that's how most people operate. But there are a few people, through education and through more advanced and sophisticated moral development, are able to achieve post-conventional moral reasoning, where they are able to not only consider their own needs, but actually more so consider the needs of society, a Martin Luther King, a Gandhi, someone whose concerns are not largely inspired by self, but more thinking about the social good. And that is something that he articulates as rare and requires both not only empathy and moral development, but a degree of education and the ability to think abstractly beyond oneself intellectually. So let's move beyond the stage theories and theorists and talk about some more streamlined theorists in our discussion of personality theories. Remember Albert Bandura's social learning theory that we learned through observation? Well, he also came up with a term called self-efficacy. And this has to do with our sense of competence. And it's not a global term. It's more specific to a situation. For example, you may have high self-efficacy or be efficacious in one arena, not another. You might feel like a very good dancer, but not a very good singer. So you're high self-efficacy in one area, and lower self-efficacy in another. Self-efficacy and self-esteem are not the same, but it does help when you have high self-efficacy in something. It tends to increase your overall general feeling about yourself or self-esteem. Another rather streamlined, not stage theorist, but personality theorist is Julian Rotter in his locus of control. And he says if we feel what's known as a high internal locus of control, we feel that our behaviors determine outcomes in our life. If I study hard, I'll get a good grade. If you feel it's luck or happenstance, if I study hard, it doesn't matter, that's external locus of control, and that's associated with a lack of psychological well-being, things like anxiety and depression. Whereas a high internal locus of control is associated with just feeling better and functioning better psychologically. Carl Rogers articulated that we respond best to positive regard, to being affirmed, being loved, either unconditionally, that we're loved by someone who really doesn't matter if we're rich or poor, they love us, that's unconditional positive regard. But there may be strings. It may be contingent upon acting or doing certain things, behaving in a certain manner. And that is conditional positive regard. If you get good grades, I'll give you the car tonight, or I'll be more complimentary of you. This is conditional positive regard and associated with Rogers. There's another model called the Big Five model, or the five factor model, and it has a good acronym, OCEAN. 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 And it's interesting, you would think this would be used clinically, but here it's usually not discussed in this form, but it talks about generally five traits that people have. O is for openness, being open to new ideas. Conscientiousness is C, dealing with discipline, how disciplined you are. Extroversion E, hopefully you have high E, being outgoing, or at least some moderate E, because that's usually associated with better, more psychological well-being. Agreeableness or friendly A. The only negative trait here, which is sort of surprising because psychology tends to highlight more, which is that which is psychopathological. But anyway, in this model, there's only one negative trait, and that's N, or neuroticism, anxiety or emotional instability. So again, getting back to my point regarding the application of this, you would think that clinicians would say, is he high or is she high in A or N, or they don't usually talk in this sense, in this way. I guess if you did, you'd want to say someone is high in openness and conscientiousness and low in neuroticism. That would seem to be a pretty good combination. A few more streamlined models. Abraham Maslow, we're back to him again. Remember the five levels in terms of the hierarchy of needs model. From the most basic, dealing with physiological needs like water and food, to the next level, safety needs with a roof over your head, to love and belonging, to the level 4, achievement or esteem, and level 5 that most people don't get to, the self-fulfillment, which is referred to as self-actualization. Most people are not fully self-actualized, expressing themselves in a way that's uniquely theirs and independent of others. And there are many other characteristics associated with a self-actualized person or self-actualization. Someone who's comfortable with themselves, who has intimate relationships, but also, again, has that autonomy, who is really able to be intimate and understanding and really a complete person who feels comfortable in their own skin. I'm repeating myself a bit, but this is really an unusual set of criteria for people to achieve. It's doable, it's achievable by some, but not most. And finally, one more theorist. We had Maslow, Abraham Maslow before. Now we have Leon Festinger and his cognitive dissonance theory. According to Leon Festinger, it's around the 1950s. We have I'm not going to test you on dates, so I've mentioned a few, but I wouldn't worry too much about that. Anyway, what he says, he comes up with or presents the term referred to as cognitive dissonance, sometimes referred to as cognitive dissonance theory. And this is referring to a degree of psychological discomfort. And of course, we don't like discomfort. And Festinger outlines this as mentions that this is an issue. So we're motivated, it's sort of a motivational model to a degree. Certainly Maslow's model is motivational. And in terms of that, Festinger says, okay, if you don't like something and it creates tension or discomfort or dissonance, you want to change it, right? So how would you change it? Well, there are two ways to change something, if you really want to sort of narrow it down. And that is change the way you think, so change it cognitively, or change it behaviorally. So you may have a job that you don't like, and you got a couple of choices. I can leave my job, or I can sort of reframe my job and think of it, or conceptualize it differently, rework it in a cognitive sense. So, you could almost apply this to any situation. You're in a relationship and you think, okay, I'm not crazy about this or that aspect of that other person. Either you can reform that viewpoint, or maybe you work on changing your relationship in some way, how you are interpersonally with one another. So again, it comes down to either changing thinking or behavior to reduce the aforementioned dissonance. I guess very quickly as a review, hitting some of the highlights. Intelligence, you should know intelligence quotient, mental age over chronological age, that Simon and Binet were the developers of the first IQ test in France. Multiple intelligence associated with Gardner, things like linguistic, analytic, emotional intelligence. Emotional intelligence, also sometimes referred to as social intelligence, dealing with our understanding of ourselves and others. IQ tests are considered aptitude tests, our ability to learn. Achievement tests are what we have learned. Sometimes you look at two and there's a disparity with IQ being higher than intelligence, IQ being higher than achievement rather. This is often suggestive of a learning disability. Most tests, like the SAT and the IQ, are more reliable, consistent than they are valid, measuring what they claim to. And there are multiple environmental factors that come into play which reduce this notion of validity, that your education, your family of origin, the school, the quality of education on many levels affects IQ. In terms of personality theories, we talked about some stage theories. The Freudian psychosexual development, 5 stages: oral, anal, phallic, latency of genital. Oral, the focus on the mouth; anal, with toilet training; phallic, the boy's fascination with mother; the Oedipus complex, the girl with father; the Electra, latency; sexual matters are on the back burner; genital, if there's some fixation, you've gotten stuck in any of the first 3, you see it often here expressed. Freud said we have these impulses, aggressive and sexual. You have to sort of ward them off, defend against them. You can do so by denying them, denial, justifying, rationalization, redirecting sexual energy into non-sexual arenas, sublimation, unconsciously blocking something out, repression, consciously blocking something out, suppression, taking something you don't like, unconsciously blaming someone else for it, projection, he's a liar, a thief, reaction formation, you have an instinct or an impulse for something, you do the opposite, you're really aggressive, you become, you do something that is rather passive or pacifistic, like being an anti-war activist. His therapy, Freud's therapy, was psychoanalysis. The goal was bringing the unconscious to the conscious level. I had certain techniques associated with this. Analyze the person's response to the analyst, or how they transfer the feelings of parents to the analyst. That's the analysis of transference. Analyze resistance to treatment, such as missed appointments. Interpret dreams. Say a word, the next word that comes to mind before they filtered it. This is free association. Erik Erikson, another, he's actually referred to as a neo-Freudian, someone who influenced by Freud but revised his theory. His theory was developed, Erikson that is, in the 1930s, talked about these 8 stages and 8 psychosocial crises. The first stage, infancy crisis, is trust versus mistrust. Age 2, autonomy versus shame and doubt. Age 3 and 5, are you going to take the initiative or feel guilty? By the time you get to be of school age, 6 to 11, are you going to feel competent or industrious versus feeling the opposite, inferiority? Adolescence associated with identity, a sense of who you are versus being confused. Young adulthood, 20 to 40, you're going to develop intimacy. If you don't, you're going to feel isolated. The middle-aged adult's goal is to give back to the next generation, generativity. If you don't do this, you'll probably feel stagnated. And the ultimate goal, I guess, is to feel a sense of purpose and meaning and wholeness about one's life in late adulthood. This is ego integrity at 65 plus. And if you don't have this, despair. Finally, the last stage theorist, Lawrence Kohlberg, talked about 3 levels of moral reasoning: pre-conventional, conventional, post-conventional. Pre-conventional having to do with decisions are based on whether you'll get punished or not, if you can get away with it. Post-conventional, conventional, following the rules of society. Most children, school age, and adults, adolescents and adults operate this way. You follow the mores of society. Post-conventional, you question certain things, not because you're trying to gain any advantage, but you're trying to do things that are for the greater good. This is the highest level, the most sophisticated level of moral reasoning. Most people, according to Kohlberg, never achieve this. Some more streamlined theorists. Bandura talked about self-efficacy, a sense of developing competence. You do so by comparing yourself to others. You do so by getting feedback. And it's very situational. You may have high self-efficacy in one area and low self-efficacy in another. But if you have high self-efficacy, at least one thing, that's good for self-esteem. Julian Rotter talked about locus of control. You either feel your behavior determines outcomes, that's the internal locus of control, or luck or happenstance control outcomes, external locus of control. Internal locus of control is associated with psych well-being, external lack of well-being. Carl Rogers talked about the need to be regarded either unconditionally, which is the most desirable. That's not the response you get from loved ones is not specific to your behavior, but just a general affirmation that you get, regardless of your behavior. And sometimes, though, you're regarded conditionally, that it is contingent upon your being a good person or making a certain amount of money or getting, certain grades. The five-factor model, also referred to as the Big Five, the acronym here is OCEAN: openness to new things, conscientiousness with discipline, A with agreeableness, N with neuroticism and emotional instability, so OCEAN. Maslow's hierarchy of needs model, the five levels, from physiological to safety to love and belonging to achievement, sometimes called esteem, to self-fulfillment, called self-actualization. And finally, Festinger's cognitive dissonance theory, that we're motivated to reduce discomfort either by changing our thinking or behavior. I hope this helps. Again, this is a review for exam 3 in Psych 111, fall 2020.